osteomyelitis is what me, Alexa, and Margaret presented. So it is an infection in the bone. It's usually spread throughout the bloodstream. It includes, like, it happens if you get a bone fracture or an open fracture or something. It is rare. Only 2 of every 10,000 people actually get it. It's mostly seen in those that struggle with, like, diabetes. So symptoms include fever, irritability, fatigue, nausea, and tenderness, redness, or warmth in the affected area, swelling, and loss of range of motions. So acute develops over like 7 to 10 days, and it's easier to treat than chronic. So the assessment is that you have to first assess the patient's history, so like different bone traumas and injuries that happened, and then you have to do physical examination. So this actually reveals what symptoms are actually present in the patient, and then draining the wound is like it helps like examine what actually was hurt or damaged. And then psychosocial, so in the patient, it can increase levels of depression and anxiety because they have to now live with it. And then it decreases mobility, and then that can affect body image because you think about it. So the causes are, it can be either direct, which is like a break in the skin, and then indirect is transferred throughout the bloodstream. And then in children, it's most common to be seen in the long bones and arms, and the arms and legs. In adults, it's like the feet, spinal bones, and limbs. So the diagnosis is that pain is related to swelling and inflammation. So the pain reading is greater than like 5 out of 10. And then impaired physical mobility. So like it decreases the level of function with daily activities, like even just walking. And then it decreases the pulse of the heart. And the treatments is surgery. So during surgery, they remove, like first drain it, and then they remove the affected area, like the diseased bone and tissue, and then replace it with part of a healthy bone or tissue so that it's still intact. And then in order to restore blood flow, they take that bone the healthy bone that they took out or tissue, and combine it and put it in there to regain the blood flow. And then they remove the foreign objects that happened during the procedure. And then the medications, so they're either oral or they take antibiotics that are up to 6 weeks. And then they encourage to stop smoking if that is part. And then the outcome is usually good for acute, but with chronic, it can worsen with the surgery, which is when they need to amputate. It's mostly because of diabetes or poor circulation into the specific area. And then you just have to manage the pain. Yeah. And that's all I can say.